If you can't go left, you can always try right. If you can't go right, you can always try forward. But no matter what you do, we'll always create a memory because you are special.
Hello and welcome to RBV, the Milestone Whisperers, where we discuss milestones and the journeys to get to them. I'm Dr. Rashida, your host, and today I have Jen
Uschold.
Uschold. Hi, nice to meet you, Jen.
Nice to meet you too.
So I am super excited about our episode and our discussion today because you're a fellow PT, so you know PT. And I was looking over your website and your page and everything, and I'm excited to talk to you because chronic pain is something that we see a lot as PTs. So go ahead and introduce yourself, and then we could dive into a conversation.
Absolutely. As you just alluded to, pain is no joke. And the good news is we've learned so much about how to help people with pain in recent decades. We're just not doing a good job of disseminating that information. So thank you for having me. I have been a PT for 35 years, which is a very, very long time. And I did a deep dive into pain science probably around 13 or 14 years ago. And so I'm just super excited to really bring it all together and help create an individual plan for each client, because now there's so much more information and knowledge that we have. And I also teach pain neuroscience education to clinicians, and I'm also integrating lifestyle medicine. So I'm super excited to be here, and thank you.
Yes, thank you. I appreciate you for so I saw that you filled out the form twice, so thank you. Because I have someone that helps me with it, but it's been a little bit just tough to juggle. So I apologize for not responding right away, but I'm excited because I don't typically work with patients that have chronic pain. So I'm a early intervention physical therapist mainly. I do dabble a little bit in home PT now, so I am starting to get into those patients that have pain issues, but it's more, home PT based. I'm not in the clinic anymore. So you're going to help me a lot with just understanding how I could advocate for family members and for parents or grandparents of the babies that I work with that may suffer with chronic pain.
Absolutely. Yeah, I love all.
Yes, and it's multifold because when people think of a physical therapist, a lot of times they're like, oh, they're teaching me exercise and, and that's about it, but chronic pain is a real thing because a lot of people suffer with it. I have arthritis in my knee that I didn't know was going to continue to progress, and just trying to manage that with getting on the floor with babies all the time has been a lot. So I'm even in that group of people that now I have chronic pain as well. And I'm trying to modify how I do things to manage it. So tell me a little bit about the setting that you work in. Do you have a clinic, or are you, I know you do coaching as well. So tell me a little bit about that patient population specifically.
Yeah, I'd say there's three main tenets to my business. The first is one-on-one in-person physical therapy, which is great for people that live nearby. And then I also have a group program, which is merging pain neuroscience education, which is stories and metaphors, with movement and laughter and social connection. That's a 6-week program called Pain is No Joke. And then I also am coaching people one-on-one. I've had someone in Switzerland, someone in Australia right now. So there's just so much we can do for people with pain. We don't have to be in person. And then the third piece of my business is speaking, whether it's podcasts or conferences, to try and get this message out there. Because my message is that pain is not a life sentence. We have the science, and we have to get it to the people who need it.
I think that's great because evidence is the evidence. And a lot of times you have to sell people on the science behind pain management and not be so quick to medicate or get surgery, and things are manageable with just learning how to work through it, So what's your approach?
Yeah, I'm going to introduce one thing that I like to say. We, the pain geeks, we prefer to say that we are treating pain as opposed to managing it. Something like type 1 diabetes, we don't have a way to really abate that. So we're managing type 1 diabetes. The flu, a cold, we treat it. You may get one again. However, you learn the strategies and the tools to avoid it from happening and to recover. The same is true with pain, is we really are trying to embrace this approach of treating it versus simply managing it. And that's my first little piece of information for you. And
yes, thank you.
Yeah, absolutely. What does a session look like? That's such a great question. So I send out several forms. I am aware and in tune to how many forms to send people, because you and I both know on both sides of the medical world, sometimes we are inundated with forms. However, these forms, some of them give me a lot of great information to help guide the subjective part of the evaluation. And it is not uncommon for me to have a really good handle on what is a dominant mechanism by the end of the subjective evaluation. And then that informs what I will do with different manual tests and strength and etc. And then that all together, along with the client's priorities and goals, informs what treatments we will use. We could go into deep, dark weeds on any of those, but I'm curious what your thoughts are.
Yes, I love that part about, just tailoring the information that you get from the forms and in your session that way, because I know I've been a PT it's coming up on 18 years, so about a little bit about half the time that you've been a PT. But I just know, when I worked in the clinic setting, and even when I was in school and I went through my internships, it's like cookie cutter. And that's the mindset that I have a lot of times when I have just someone ask me a question about, oh, my back hurts when I bend over, or, and then I go into McKinsey, because it's like, that's what I know, So it's so cool to hear that I'm not going to say that you're an older therapist, but that you are a very experienced therapist, but you tailor it to that patient, and the testing that you do, and the manual muscle testing, and just the direction that you're going to go with for treating that patient is going to be tailored for them and specific for them, not just the diagnosis or just their complaints.
Yeah, I don't know if you've heard of Adrian Lowe. He's a big lead neuroscientist, and he's also a physical therapist. He has this beautiful statement: treat the patient, not the label.
Yes. I think, even with the because I do early intervention, so I'm working with infants and toddlers. So say a child, a lot of times they don't have a diagnosis when I first start working with them, but they may end up getting diagnosed with autism or something else, cerebral palsy that they didn't catch when they were first born or whatever. But I always tell parents when they just don't want to use that label, I say it just helps us understand what we're seeing with the baby, with the toddler. Is not going to define what we're doing for them or how we're treating them. We're still working on what those impairments are, or what specific goals that you want to achieve for your child. Do you use that same type of approach with your patients, though?
I really like the way you just said that. The challenge that we have is, this is my opinion, is that when people go to providers and the provider doesn't know, the symptoms don't make sense, the tests come back clear, and the client is still struggling, sometimes we just slap a label on there to give them something, rather than let's dive deep. Let's find a provider who has a different skill set that can help this client, because the labels don't help. Like 1 or 2 labels, maybe that's helpful, and I really like the way you described it. However, some of my clients, they have 6, 8, 10, 12, 15 labels, and there's this fascinating paper by Schramer, I think his name is. It's from 2020. It is a list of, I think, over 250 different diagnoses that really all come back to a sensitized nervous system. However, if we've been able to come up with 200 plus labels, then clearly a sensitized nervous system has an infinite way to show up, which is why we have to circle back to treating the person individually versus what you said, the cookie cutter.
Yeah. And you know what? I was on your page yesterday because I wanted to like get a little bit of background in terms of like what you post and what and all that. And I really love the analogy that you used about the alarm.
Yeah.
Yeah. Yeah, because that is so true. And it's like if you don't hear my dogs barking in the background, it's like they bark for every little thing, the birds, the squirrels, and it's like these things sometimes don't want to bother them. They're just out in nature. And then sometimes I feel like it's a squirrel or two that's intentionally coming up to our patio door trying to like push their buttons. And I think that's sometimes what we do with pain, it's like sometimes we'll like blame like, I don't know, something that isn't necessarily the culprit. It could exasperate it, but it's not necessarily something that you should stop doing, like walking or like getting on the floor to play with your child or going to a child's football game,
People are often looking for one lightning bolt moment that caused their pain. They're looking for one fix or one solution to get out of pain. And exactly what you're saying, it's just not that simple. You mentioned cookie cutters before. I don't know if you've come across any of my cookie analogy. Would you like to hear my?
Not yet.
All right. So I'm going to give you the brief version, but I'm going to include you a little bit. Rashida, what is one of your favorite types of cookie?
Chocolate chip cookies.
Awesome. And if you were to make a chocolate chip cookie, what are some of those ingredients?
Flour, eggs, butter, milk.
Great. So if I were to give you just a bowl of flour, would you have a great cookie?
Absolutely not.
And if I were to give you flour with bugs in it, along with the other ingredients, would you have a great cookie?
No.
Not at all. So the ingredients matter. Our symptoms matter. However, they're only a part of the story. And I'm going to connect this to Louis Gifford's mature organism model, which talks about pain being a combination of inputs, processing, and outputs. So for our cookie, the inputs are the actual ingredients, and are they high quality ingredients or not? So then we move into the processing. And for our cookie, oven temperature matters, shelf matters, humidity matters, altitude, all those different things are going to impact the processing of our cookie. And when it comes to pain, our beliefs about pain, our experiences about pain, culture can impact pain. All of these things are part of the processing. Fun fact, your brain processes 11 million pieces of information every second to protect you. So that's a lot of processing. And then it is those inputs from our tissues and our environment and the processing of our beliefs, experiences, and more that leads to the output. Is it pain? Is it fibromyalgia? Is it vulvodynia? Is it anger and depression? Or has our system processed and experienced it? We're good to go. Have a great day.
I like that you bring up the mental part of it because we see that a lot with just people that suffer with that chronic pain. And I don't see it personally, I'm not going to say that's my patient population, but, it gets people down sometimes, where it's like, is no one listening to them? And like you said, the tests are coming back. MRIs just show like mild changes, and it's like, how do you get past that part? Like, how do you get past that layer of the mental toll that it takes on people to get them to buy into like what you're, the evidence and the research that you've done?
Yeah. So people often ask me, are you talking about physical pain or emotional pain? And the answer is yes. because they
Yes.
always go together. We cannot separate them. And there are 9 parts of your brain that participate in every pain experience. So which one shows up more, which one is experiencing the greatest real or perceived threat, is where you will feel your symptoms. Is it that the amygdala is on fire? You will have more fear. Is it that your GI system is on fire? You will be feeling more GI symptoms. It could be the muscular system. It could be the cognitive system, forgetting things, brain fog. And so helping clients understand the complexity of it with simple stories is how they start to get curious and then buy in.
I think that's great. And my mom is a baby boomer. So you brought up brain fog, and that's one of her main things that bothers her now. And it's like, it's the brain fog. I don't know if it's menopause or if it's, the pain or just stress of life or what, but like she really gets hung up on like not being able to remember some things, or like things seem foggy to her. Now, do you have a specific or like the majority of your patients and clients, are they women that like middle-aged women or baby boomers or do you have like a wide range of men, women working?
Pain does not discriminate age, race, where you work, what state you live in.
Yes.
No. Oh, well, though, this is fascinating. This is an older statistic, so I can't exactly pull it up for you. But one of the greatest predictors of whether or not you will have back surgery. Any idea what it is? What would you guess?
I don't know. A sedentary lifestyle?
This is absolutely crazy. Your zip code.
What?
Yeah.
How so?
Now this is what I have to try and remember. So based on your zip code, they've done research on this. Is it the insurance coverage there? Is it that the doctors are quick to go into surgery? Is it that clients are, more demanding of a solution, even though it's rarely the solution? I can't remember all the variables, but I remember when I heard that, I was like, you've got to be kidding me. And so this hopefully is a clue to everyone listening that there is so much more than pain than where you feel it.
That's true. Like access and, just geographically and social economic status and things. It's so funny you bring up zip codes though, because that's how I choose my clients. And it's not because of like the zip code specifically. It's basically like I pick zip codes that's close to where I live. So like I'm in Pennsylvania, but like I work in the Philadelphia region for early intervention. So like we pick our zip codes, and I don't know, like for me it's only because of proximity. It's not because of like families are more compliant in one zip code than the other, or whatever social economic status. It's more so like on this day I'm gonna be in this area, so everybody in this area, they have to be within like 10 minutes of each other, and then this next day I may be a little bit farther.
That sounds really smart, and especially early traffic, you don't want to be messing with that. You could be driving 4 hours if you did that.
yeah, and it's crazy. I'll have my days where sometimes it takes me like 20 minutes to get to my next one. I'm like, oh man, like this day is kind of ruined because it's taking all that time to get to the next one. This is going to take like another 20 minutes to get to the next one. I'm like, I only see like 4 or 5 people that day because of the travel time.
Yeah.
But I'm sure like it's some truth to that, even with outcomes in this age group that I work with, because some zip codes may have more access to the playground or to play groups and things like that, and their children are getting more opportunities to be around other children, to engage, and they learn from watching other children. So I could now that you mentioned the zip codes, I could definitely see that being a factor.
Yeah, I agree with everything you've said, for sure. Yeah, absolutely.
Yeah. So how does the coaching come about in terms of like especially like that's cool that you have like someone in Switzerland, and how does that come about though in terms of like how you treat them? Because I know during COVID, and I was exclusively telehealth, PT is hard to do virtually. It really is. So how do you approach that, especially with the pain part?
I love that question. So pain neuroscience education is education. So that we can do virtually very easily. I have cards, I have slides, so there's different ways to make it engaging and interesting for them. And then there are 4 main pillars of what we know we need to do to help people with pain. And those are the education, sleep, exercise, and goals. And so all 4 of those can be done in a virtual manner. I don't need to exercise with them. We just need to find exercise or movement that they are willing to do, as opposed to, it's not about me. It's not about what the research says you should do 30 minutes. Because if I tell them to do 30 minutes and their system is ready for 10, all I'm going to do is make them worse. So those 4 things are pretty easy to do in a virtual manner. Then we have the PNE Plus program, which is 22 plus additional evidence-based strategies to also help people with pain. Is it yoga? Is it journaling? Is it laughter? Is it manual therapy? Is it isometrics? So within all of that, many of them can be done virtually, or we find them a yoga practitioner nearby, or we find them, sometimes people need counseling. And so there's really so much that can be done virtually. Manual therapy is but one of more than 24 strategies. And sometimes people get a little addicted to the manual therapy.
Yeah, people expect it. I feel like
there's a reason they expect it, because it's what we've done.
Yes. I feel like even just like that misconception with at least my family, they're like, Mom, can you stretch me? I'm like, you don't need me to stretch you after you finish your workout. You need to stretch yourself before and after. You could do that yourself. I could walk you through it. You don't need my hands on.
How old are your kids? I'm curious.
So I have a just about 16-year-old, just about 14-year-old. Those are boys and they play football. And then I have a 10-year-old daughter who does MMA and cheer. And now she wants to do flag football. So
that's awesome. I have 3 kids too. I wonder, I don't know the answer to this, but do you think your boys who play football and they sound like they're high school age or beyond, are they getting passively stretched by the trainers so that they have like learned to expect that?
Not at all. And it really grinds my gears that it doesn't, that they don't. Because I'm like, no one is, y'all doing all this lifting, all this running routes and all these things. And why aren't y'all stretching? Or why don't they show you how to stretch? Like, who's the trainer? And I guess I could take a little bit of accountability because I don't know, like, I only know the coach. So I don't know, like, how practice goes or anything. So I only get from what they tell me. My husband is the one that takes them and everything. But I think that should be part of their routine when they have these long workouts.
When my son played football, it was awesome. They had yoga Wednesdays. Imagine the whole football team doing yoga. I was like, hallelujah. Yeah.
Yes. It makes such a difference. Absolutely. It really does.
Yep.
Yeah. I'm going to suggest that because I think that's why a lot of injuries happen with the young kids, because they aren't stretching properly and they aren't.
That is a very big Pandora's box you just opened. Why kids get injuries? I don't think we have time for that today.
I know. I feel like we need to do a part 2 for sure.
I would be happy.
Because this is such a great conversation. All right, but back to the chronic pain though. How young do you have clients? Do you have like any like young ones that's kind of like they have different priorities? I mean, of course the pain is an issue, but like their priorities may be different than like a middle-aged person that wants to do their job, you know?
I was thinking about this earlier today, and I was hoping you were going to ask because we have done the research on pain neuroscience education. Into the 90s, they get it. The sweet spot is 7th grade for kids. And then as young as 3 or 4, they get it when we use these stories. So just last week, I've never had a 3-year-old. So I had my first 3-year-old who sprained his ankle. And I did a little bit of manual with him, and we did some of the stories. And I'll see him again on Monday, but I think he's going to be doing better.
Wow. Oh my goodness. That age is so cool. It's just
he is the most well-spoken 3-year-old I have ever met. Oh my gosh, it's amazing. Yeah.
Oh, I love that.
Yeah.
So with early intervention, I stop at 3, and then like it's a program in my state, 3 to 5-year-olds are the next program, preschoolers. So I usually only see kids till they turn 3. But I used to do 3 to 5-year-olds. That's my favorite group from the pediatrics because they are sassy. They want to like be part of their care. They are so creative with, cognitively. They're just like, I want to do this. I want to take part. I want to be independent and all that. So that age group is fun. So I know you're going to have a blast with that 3-year-old.
Oh my gosh, he's so cute. You mentioned something earlier too about parents and grandparents. We've also done some research on the importance of teaching parents and grandparents how pain works so that then we can be doing some upstream work with the kids. So if we have them understand at a younger age, this really leads them to a better life. And this is also interesting too. It's not kind of what you'd think, but we have the research that shows kids who play contact sports at a younger age, not younger, but kids who play contact sports, they are less likely to have chronic pain as adults.
Really? Oh, so when my kids,
as a football mom, you probably want to hear that.
Yes, because I am so against them playing football, but I support them because that's what they want to play. I'm like, can y'all do something that's not contact, like do swimming or something? But they want to play football, and it just scares me so much. But that is so important, like teaching the parents and grandparents, so that way it could trickle down to the younger kids, so that way they don't suffer through things, down the line. And I like to bring together the different age groups and things. So it's so cool just to watch my mom as a grandmother, like watching my daughter do her martial arts. And my mom is like, I remember when I was younger and I used to, do this. So it's like, it's so cool to just hear that you practice that too. It's like teaching them so they could teach the younger ones. So
yeah. Can I tell you a very cool story? It's one of my favorites.
Yes.
All right. So I've known this family for 5 or 6 years. Their kids are currently, I think 11 and 8. And every year it is a disaster. Flu shots, injections, blood draws, whatever it might be. They are fearful for weeks. There's writhing, there's crying, there's screaming, all of it. And so every year afterwards, I say, you have an entire year to prep your kids so that it will go better next year. And most of the time, they don't, but that's okay. So this year, one of the boys said, okay, I will do a 30-minute pain session with Jen. And this boy did some other things with his parent to help him prepare. And the other boy said, no, I will not do a session with Jen. And the only thing he agreed to was to practice injecting an orange with a needle. So that is it. So now the first boy went, screamed, cried, writhed, took him hours and hours, I'm not exaggerating, to recover from this one needle poke. The other boy went and he was sitting there with the parent, and the parent says, look into my eyes. What colors do you see? They had already done these other things. And finally, the little guy says, is it done? And it was done.
Wow.
0 recovery time. Hours of recovery time. And interestingly, it was the 8-year-old who did better and chose the pain science session.
Wow, that's phenomenal. And that's straight evidence right there, just to show like the efficacy of their preparation and understanding like the neural system and everything.
Yeah.
That is so good. I may need to contact you for a session because I'm so scared of needles.
I would be happy to help you with your fear of needles. I have a friend, she's so afraid of needles that she has to be sedated every time she gets a blood draw. Like, that's a big commitment.
Wow.
Every time you need a blood draw, or I don't know if it's for all shots, but yeah. Isn't it interesting?
Yeah. Now, I'm not that bad. I just need like someone there with me. But
that works.
Yeah, it's a phenomenon though. Like, some people just are fearful, but that 8-year-old, kudos to him, because that's young to even take that autonomy of like, this is what I'm going to do to prepare for it, and it worked. So,
and I think this was probably 6 months ago, maybe even longer. And then the parent told me a story just the other day saying that the little guy started talking about something. He scraped his knee and he says, well, wouldn't Jen say whatever it was? And the parent was like, yeah. So he remembered.
I love that. So you're making an impact for sure, because he's carrying that over into just everyday scenarios, not just the needles.
Yeah.
That's the beautiful thing of being a physical therapist, though, is that you that's the reward. Like, it's like people they remember what you taught them and they carry it along with their daily lives, which is a beautiful thing. It's a very rewarding experience being a PT in all aspects.
I think so. Yes, I agree.
Yeah. So let's tell the guests that's the audience that's watching how to get in contact with you if they would like services, or just to follow you. What's your socials and your website?
Yeah, awesome. Thank you. So my website is my name, JenUschold.com, which you can see on the screen there. Yes. And I have the Pain is No Joke program, which I'm super excited about. It is in person, and also I was just looking at dates to launch the first virtual one. So that is a nice entry point, and it's fun. And then I'm very active on LinkedIn, which is just my name on LinkedIn. There are actually 2 Jen Uscholds on LinkedIn, which is very interesting. So make sure you find the physical therapist and not the other one. And Instagram, I'm not as active there. I think it's Jen Uschold, but I'm not exactly sure.
Yeah, I found you on there. We'll tag you anyway, even if you're not active on there. We'll tag you when we put up the clips and everything. Awesome. I follow you from both the pages, so.
Can I offer your audience a free gift?
Yes, please.
Yeah, so I have something called the PainLESS Toolkit. Pain-free is not the goal, because imagine putting your hand on a hot stove and not feeling it. So that's why we're talking about being painless for life. And that is a set of 52 cards, little tips for the day, comes with an ebook. But what I'm going to send to you is a link for your readers to get a mini toolkit, which is just, they're all still practical tips, but it's just a taste of that whole kit.
Oh, thank you so much. Yes. Oh, that's awesome. I think that's so cool because I'm a visual person. So having cards and the reference is so good. So I'm going to definitely take advantage of that. And I'm going to share it with my family members that reach out to me and they're like, well, I have sciatica or I have this. And I'm like, I'm going to try my best.
Exactly.
Yes. I'm trying my best to help you with those.
As an early intervention therapist, you're getting the questions that the orthopedic outpatient PTs get. And you're like, I am just early intervention. I have 2 sisters who are PTs. We do not survive in each other's world. One is more pediatric, like you. The other one, she does rehab without walls. She goes into people's homes. So we have very different, lovely careers as physical therapists.
Yes. And I always say that I stay in my lane.
Yeah, there you go.
I stay in my lane. Like with my both my sons have had concussions, unfortunately. They did well with those, but one of my sons had lateral malleolus fracture, and I took him to a sports medicine PT because I said I could rehab your ankle, but to get you back on the field, you need a sports medicine PT to do that.
Yeah, I think that's.
And I took him, and he listened to him. He didn't really listen to me with the exercises anyway. So
exactly,
I know my lane.
Yeah.
How cool is that to have 2 sisters that are PTs as well?
Crazy, right? Yeah.
Yeah. Yeah, my sisters are in different worlds. Well, I have a sister that owns a daycare, so we kind of collaborate with the developmental part of
Oh yeah.
things. So that's cool. My other sister, she is like, kids. I had my kids. I don't need to worry about kids at all. But she likes
That's
being
funny.
a aunt. But yeah, but yeah, that's really cool. I appreciate you even offering the audience the free gift, and your expertise is such a wealth of stories that you told me today that I think that will resonate with other people. So I can't wait for this to be posted. I think they'll post it in a week or two. Well, the clips in a week or two. They'll probably post the actual full episode right away on YouTube.
Okay.
So I'm on YouTube. Yeah. So
Yeah.
I'm so excited to share everything. And I think we will have a part 2 in the future, because I want to dive a little bit more into injuries and things like that. But yeah, thank you for coming on a Saturday, changing the time too.
Good. Yeah, life happens. Absolutely. Yeah. I've got
Yes.
one more message for your audience.
Mhm.
While pain is normal, living in pain is not. It doesn't have to be that way.
Yes, I agree. It's just, you don't just surrender to the pain.
Yeah.
Yeah.
And it's hard. It's not an easy journey. It can be done.
Yeah. Thank you for that.
Yeah, absolutely.
All right, Jen. Well, nice meeting you. Oh, you're in the DMV area, right?
Yes, I am. I'm in Alexandria,
Okay.
right outside of DC.
Okay. All right. So yeah, so that way everyone would know where you are. And I hope they look you up on socials too, on LinkedIn and your website and everything, so that way they can find you, even like from a virtual standpoint. So
Awesome. Yeah.
all right. Thank you. Have a happy Saturday. Talk to you soon.
Have a great
Bye.
day. Bye-bye.
You too. Bye.